Okay, everybody, Dr. Rafich here from Vet Triage. We are continuing through this issue of JAVMA, January 15, 2015, and we are talking about this case report, Triceps brachii muscle reconstruction with latissimus dorsi muscle flap in a dog. And so this is the dog here, not using the right thoracic limb. We'll get into that, and then here's the pictures of the surgery itself. By the way, Dr. Pavletic, who is the primary author of this paper, he trained me when I was a surgical intern in 2006 to 2007 at Angel Animal Medical Center, which is where this paper was published. Pavletic is known to be pretty much the master of soft tissue surgery in the field, so it was an absolute honor to work underneath him. And he keeps on publishing crazy stuff like this. He makes surgeries like this look very easy. So he's really, really good. All right. 6-year-old female border collie, severe deformity of the right thoracic limb. On physical examination, the shoulder was flexed, elbow was extended, right triceps brachii muscle was atrophied and contracted, resulting in a resistant tension band effect that precluded manipulation of the right elbow. Introduction. The dog had an MRI done that showed muscle atrophy of the supraspinatus, infraspinatus, subscapularis, hyperintensity of the subscapularis, and distal triceps brachii muscle was also evident on MRI. Physical exam showed the atrophy of those muscles. And the triceps on the right side atrophied hard and contracted, resulting in a resistant tension band effect that rigidly fixed the right elbow joint in extreme extension. And then, so in this picture of the dog here, you can see that there is atrophy and contraction of the right triceps brachii muscle, non-weight bearing lame on the affected limb, shoulder flexed, elbow extended, limb carried against the body wall, but without signs of pain. And then in this picture, the surgical picture here, you can see the right triceps muscle reconstruction by means of a latissimus dorsi muscle flap. So after Dr. Pavletic performed the flap, he inserted a 10 millimeter flat drain, and that's the white structure here. That's the drain entering the surgical site. He attached a 100 milliliter vacuum reservoir at the end of the drain. The dog returned for drain removal 4 days post-operatively, then started physical therapy. For the first 4 weeks, he was doing physical therapy twice a week and then once weekly for the next 8 weeks. The therapy sessions included low-intensity laser therapy to the right triceps and shoulder region at 6 joules per centimeter squared, then increased to 7 joules per centimeter squared. Hot pack was used, massage, gentle manipulation. A small carpal brace was placed on the left thoracic limb. So that's interesting. I never thought about placing a brace on the opposite side to help support it while you're working on the right thoracic limb in this case. Physio rolls, underwater treadmill. The treadmill speed was 55 to 65 steps per minute. Wheelbarrowing, the speed was eventually increased to 65 to 100 steps per minute. After 5 weeks of therapy, the patient would ambulate on the right thoracic limb about 60% of the time, so weight bearing on 6 out of 10 steps. After 2 months, 90% of the time was weight bearing for 9 out of 10 steps. He did biopsy the skeletal muscle, and it showed regional fibrosis, focal acute myofiber degeneration, rare myofiber regeneration, minimal fatty infiltration of skeletal muscle fascicles. Features of acute damage were minimal, therefore a focal monophasic rather than polyphasic reaction was favored. The predominant microscopic lesion was one of chronic or previous myofiber damage, resulting in replacement fibrosis. Discussion. Latissimus dorsi muscle is a flat, almost triangular shaped muscle overlying the dorsal half of the lateral thoracic wall. Its location caudal to the shoulder and brachium allows the surgeon to elevate the broad muscle on the basis of the dominant thoracodorsal artery and vein, as well as innervation, which is the thoracoldorsalis nerves and the pectoralis caudalis nerves. Perforating intercostal vessels also supplement the length of this muscle to a lesser degree. Their ligation during latissimus dorsi muscle elevation from the thoracic wall does not affect its function. The most caudal border of latissimus dorsi muscle attaches to the fascia of the last 2 or 3 ribs. The action of the latissimus dorsi muscle includes drawing the trunk forward and possibly laterally to a variable degree. Contraction of this muscle depresses the vertebral column, supports the limb, draws the limb against the trunk and draws the free limb caudally during flexion of the shoulder joint. Clinically, loss of this muscle secondary to trauma, resection, or transposition does not adversely affect forelimb function in the dog and cat. As a result, this broad-based superficial muscle is ideally suited for reconstructive surgery within the general arc of rotation. The action of the triceps brachii muscle is used to extend the elbow and fix it in position during weight bearing. Loss of this action will result in the inability of the dog to weight bear on the affected extremity. The triceps muscle consists of 4 heads, the long, lateral, medial, and accessory, with a long tendon attaching to the olecranon. This muscle group is innervated by the radial nerve, supplied by the branches of the deep brachial artery. The deep brachial artery is a branch of the brachial artery as a single or double branch in the proximal third of the forelimb. This small vessel anastomosis with the caudal circumflex humeral artery proximally and the collateral ulnar artery distally. The radial nerve enters the triceps muscle cranial to the deep brachial artery. In the patient described in this present report, the bizarre history and lack of specific histopathologic change in the biopsy specimens precluded determination of the etiology, although these may have been included with ischemia, trauma, or mechanical injury. Effective surgical transfer of the latissimus dorsi muscle in dogs as a singular flap, bipedical flap, or compound or myocutaneous flap were first reported by Dr. Pavletic in the literature. Single pedicle and bipedical muscle flaps are considered the preferred methods to reconstruct the thorax after major tumor resection involving several ribs. There are numerous articles regarding the use of latissimus dorsi muscle in human reconstructive surgery, both as rotational flaps or as free flaps employing microvascular anastomosis. Representative clinical application of similar flaps in human patients includes use of replacement of the biceps muscle, breast reconstruction, and cardioplasty. As a free flap, the latissimus dorsi muscle has been used to replace the quadriceps muscle group and for closure of extensive lower extremity defects in human patients secondary to trauma and tumor resection, and for treatment of complications like soft tissue injury associated with radiation therapy. So yeah, pretty cool case report. My only question really, and this may be because they did an MRI already, but if the nerves were damaged to that muscle, then would there be any concern of this procedure not working? But I presume probably because the distal portion of the limb was still functional, and because the MRI didn't show anything like that, and maybe there was no history of this, maybe that's why Dr. Pavletic wasn't worried about radial nerve damage per se. But that's my only question with this case is how confident would you have been? I presume probably this was considered a salvage procedure. I also am not sure why amputating the leg was not an option either for this dog, but maybe it just wasn't, and they wanted to look at other options. So pretty cool case report. And so for veterinarians, again, know that some of these niche options do exist as opposed to amputating the limb for the right owner and the right dog. And for pet owners, always look at other options. If something doesn't sit right with you and you want to get other opinions, then yeah, these are the specialists that you would look at to figure out, is there any kind of novel way. I'm sure this pet owner was made aware fully that if this doesn't work, that amputation is probably going to be the next step here. So, all right, guys, we'll see you again tomorrow. Thank you.